Still so many unknowns, but here's one thing we do know. The state hardest hit by the coronavirus is extending orders to stay at home. New York will remain largely shut down until at least May 15th. There are signs that social distancing measures are working there, but the crisis is far from over and millions are still in danger. Our lead national correspondent, David Begnaud, is in an eerily quiet Times Square. David, good morning. So May 15th, what else are you learning?
Well, Tony, that the governor's statements about being able to better control the spread of the virus is bearing out to be true when you walk into some hospitals around the state. We went to one in Nassau County yesterday, right outside New York City, and they are no longer overwhelmed. The caseload is much more manageable now. In Nassau County, if you set aside New York City, excluding the city, Nassau County has more cases and deaths than any other county in America. So I want you to take a look at what we saw at the hospital.
So this is our triage desk.
What we saw inside of North Shore Hospital on Long Island appears to echo what we've been hearing from New York Governor Andrew Cuomo.
ICU admissions number is also down significantly for the first time.
It's welcome news. Some 200 people have died inside of this hospital alone from COVID-19. But we were told that over the last 72 hours, they have actually discharged more coronavirus patients than they've admitted.
Thank you, everybody.
How does it feel to be wheeled out of here?
A pleasure. I think I'm on top of the world right now. Yeah. I know I get to live for another day.
In New Jersey, the Andover Subacute and Rehabilitation Center confirms that 15 bodies were held and the majority removed from a holding room Monday. The deaths are believed to be related to COVID-19. The nursing home says it has been working relentlessly to contain the virus and safeguard our residents and staff. The health and safety of our residents and staff is our utmost priority and responsibility. Francesca Veen says her grandmother is living there, but says no one in the family was told that the facility had COVID-19 positive patients.
I am sick and tired of being told that I cannot talk to her.
Around the country, coronavirus patients are dying alone. Families cannot visit them. But in Louisiana, a hospice has opened, believed to be the first dedicated to terminally ill COVID-19 patients, where families are allowed.
Yeah, I'm right over here, Dad.
Cornelius Garcia spent much of yesterday at the bedside of his father, Willie Freelo.
I'm really grateful, like, I get to see the man that raised me, kind of raised me, that brought me in this world. I can still, stand next to him and say my piece before he go.
The organization Heart of Hospice has set up inside of East Jefferson General Hospital in Metairie, Louisiana. Here, 2 family members per day are given PPE and allowed to be present at the bedside. The nurses help connect those who can't be here.
You see your sister there?
Louisiana's governor says hospitalizations are declining in the New Orleans region, which is a hotspot for COVID cases, and is now where compassionate care guarantees that patients will not die alone.
Heart of Hospice provided us with the video, of course, with the permission of the family. And Anthony, one of the most haunting things about this vicious disease is the thought that so many family members are dying alone. And so for those families in Louisiana to die with their loved ones at their side, it's really a game changer, and it means so much to those families.
Yeah, I can imagine, David. It's one of the really toughest parts of this whole thing for families. Thank you.